Hello, everyone. Welcome to Sunday Politics on Channels Television. I'm Sean Kimbaloye in Lagos. The United Kingdom has added Nigeria to its red list category as it tightens travel restrictions in an effort to limit the spread of the COVID-19 variant Omicron. A statement from the British High Commission in Abuja says, quote, from tomorrow, Monday, the 6th of December, Nigeria will be added to the red list for entering England, end of quote. United Kingdom's government's travel advisory on Nigeria means Nigerians who do not have UK citizenship or residence permit can no longer travel to the country until the advisory is revised. The rule applies to even fully vaccinated persons. The Omicron variant comes almost a year after the world is trying to figure out in handling the adaptability and the cure to the coronavirus disease, a disease that literally shut down human, economic, and social activities across the globe, bringing governments and poorer nations to their knees, and even the bigger nations were horrified by the enormity of the effect of the disease. Face masks, lockdowns were measures taken by governments across the globe to curtail the scourge and its spread. But since the emergence of the disease, a few variants have now surfaced. But how is Nigeria handling the situation? Tonight, we have the Honorable Minister for Health, Dr. Osage Ehanire, who is in Abuja studio to give us some insight on the handling and the way forward for the country. It's good to see you again, Honorable Minister. Thank you so much for coming onto the program. Let me start by asking you, how does this come to you and to the federal government, the decision of the United Kingdom or the British government to place Nigeria on its red list?
Well, we don't think that's very helpful. That's a period when we are trying to find ways to live with COVID-19 and doing everything we can to support each other. I'm talking about the countries. We all know that COVID-19 will be around for quite a time. It is not just a threat to individual countries, but it's a threat to all of mankind, and we must find a way to live with it and support each other and not disrupt livelihoods as we are trying to save lives.
I'm asking that question because Nigeria is not the only country that has recorded that the variant and the incident. South Africa, and even out of the country, several nations have experienced it. But the question I'm asking is, how does this appear to the Nigerian government when the UK came just a few days after the emergence of the Omicron variant and placing Nigeria on the red list?
Well, you know that many countries were not very happy when 6 countries in Southern Africa were placed on the red list. And the WHO also advised against putting each other on the red list. From what we know so far about the COVID-19, there are many ways to manage it. And besides, not much was known, or not much is still known about the Omicron variant. We know, for example, that there have been no fatalities. There have also been no reports of very severe illness. So actually, the rationale for being so hasty in putting countries on the red list is not something that is very helpful. It's going to disrupt commerce. It's going to disrupt family reunions. It is going to disrupt the movement of goods and services, particularly at this time of year, towards the time of the birthday of Christ, Christmas festivities.
So that is one of the worries because the world is trying to contain and trying to deal with the situation. And I know that the president of South Africa, when he visited President Ramaphosa, visited President Buhari last week, and these are some of the issues raised, that how the other countries are relating into this situation and their response. So what is the response of Nigeria in this instance? Because one then look at it that if the UK and other countries react in this way, how are we planning? What is our immediate response in handling or tackling this scourge or this disease?
Well, very good. We are going to have to discuss this at the level of the steering committee. We regularly get travelers coming in from the UK who are COVID positive. In fact, within the last 2 weeks, the COVID positive arrivals that we had were 50% from the UK. And there is genetic sequencing going on. We shall have the results soon. We don't know how many of them are necessarily Omicron variants. But if every country were going to put other countries on the ban list because they had 21 cases from that country, very soon you have a large number of countries on your red list. So I do believe that there are other ways of going about it. And we in Nigeria don't regard banning flights and banning movement of people as particularly helpful and supportive.
So I'm asking that in the sense that one of the things that a lot of the countries, I mean, a lot of people, even globally, have applauded Nigeria is some activities or the reactions of the government of Nigeria in attacking that case, although some will criticize that we perhaps would have done differently, but also some have applauded that Nigeria did well in containing that virus and its spread, and in fact, the treatment thereafter. And considering what you see in some other countries of the world, from what we are hearing about this Omicron, first and foremost, what do we know about it?
We do not know much other than that it at present hasn't been responsible for any fatality. It hasn't been responsible, as far as we know, for very severe illness. But we know that it is said to be a variant that spreads very rapidly and has, in fact, in South Africa, quadrupled within the last day or so. But again, that does not translate immediately to fatalities. Perhaps there will be those who, 5% who get more ill from it. But here in Nigeria, we have done quite well in trying to contain the virus as a whole. We have always worried about the emergence of new variants and how the variants will behave, and if they might be susceptible to our vaccines. But as long as we continue our immunization campaign, which we are doing very rapidly right now, we are about 7% for first doses, and also continue with our non-pharmaceutical interventions and public health measures, we should be able to wade through this latest challenge. And we believe that other countries are trying to do the same. And we are following the guidance of the World Health Organization. Scientists are working hard to find out more of the attributes of the Omicron variant. And it is from what we learn that we can arrange our response. But on the whole, we should look at it as a global problem, and all countries should come together, put their hands together in order to try and respond, have one response that doesn't necessarily do harm to the other's economy, while supposedly protecting another, which it might not really do.
It's sad to hear of the emergence of yet another variant of the COVID-19. We thought the world was overcoming and were perhaps eradicating or taking it off the list of things that we need to bother about, and this deadly disease, but it keeps rearing its head in new shapes and form. It was the Delta variant, now the Omicron. Why this mutation? Why this new color and this new shape emerging? When are we going to see the end of this COVID-19? That's going to be a big question on the minds of many Nigerians who are watching tonight.
Yeah, correct. That's a question on the whole world. Experts will tell you that viruses always mutate, and these mutations sometimes can be for the worse. Other times they can be harmless, and each variant is a variant of that you look at, a variant, significant variants, and so experts will also describe those ones that look particularly threatening. The Omicron was, for example, said to have mutations in 32 points, but the experts will tell you that unless you see that this variant is particularly harmful clinically, showing symptoms of severity or causing more fatalities, they are not necessarily or resistance to vaccines. They are not captured by the vaccine, by the antibodies that are produced by the vaccines. Until then, you just take a watchful waiting posture. We are taking a watchful waiting posture in looking at what COVID-19 virus, Omicron virus will present to us, to the world.
How deadly is this Omicron variant?
Up till now, it cannot be classified as deadly because the 0 fatalities have been reported. No severe illness has been reported. The UK has reported about 246, identified about 246. I think about 86 in the last 24 hours, but they have not reported any fatalities or any severe illness, not to my knowledge. And here in Nigeria, we have identified 6 cases. Various other countries have identified varying numbers, but South Africa has, I think, about 300. But from what we know, there are no fatalities, I say that again, and also no severe illnesses. So
if you compare from the early stage of the Delta variant, or when this COVID-19 reared its head in late 2019, and the Delta variant when it emerged, and this Omicron, in terms of comparison, what would you say about this Omicron in terms of the severeness that it causes and the symptoms, how severe it is compared to other variants?
Well, yes, scientists will tell you that the mutation gave reason for a lot of scare, and there was much concern about its behavior. But the real manifestation so far, and that is the thing about viruses, is that you do not understand their behavior until they begin to manifest. But the clinical manifestation of this infection so far has not been comparable to the Delta variant. We were very worried about the Delta variant too when it first appeared in India. We saw the graphic images of the havoc that it wreaked there, and eventually in some other countries too. But eventually it is being replaced now by the Omicron virus in dominance. And the picture is still unfolding until the scientific community begins to make up its mind as to how to summarize and categorize it.
So if you describe it in this manner, that means we need to be cautious and also be careful, perhaps more careful than we have ever handled this, so we don't run into possible danger as a country, especially because we are going into the festivities and the December period when people basically will have families over, and we have more celebrations to enjoy. Now that the federal government said the workers should resume, is the federal government rescinding on that decision, or you are thinking about it because now Omicron has surfaced? How are you thinking about that? Just a few days after the directive for workers to resume, now this has emerged.
Well, as I said, we are pursuing the vaccination rapidly. We are still campaigning seriously for adherence to the public health measures, and taking what I call a watchful waiting posture on the Omicron virus, and observing what happens around the world, what the scientific community says about it, what the latest findings are, and of course not rushing into judgment. And we're also not applauding any lockdowns or any prohibitions or banning of flights or movement of people until we know more. We believe that the harm it will do to livelihoods and to plants and to economies might be more than the perceived value it might do, that might be derived from shutting down the movement between countries. So I believe all countries should come together. We have been discussing that earlier today, to take a common approach and that includes the UK and other countries that are contemplating red lists and so on. We did do something with red lists in the past, but I think that the experience so far shows that it may have, it may be better to be more clinical, more surgical about the way we apply, put countries into red lists, and if there's any need for it at all, we shouldn't be very hurried or too much in a haste to create lists of that nature.
Because when we wonder that Belgium, Hong Kong, Israel, the United Kingdom, Germany, and Australia have recorded, and that's one of the questions. I mean, the reason why I started the conversation on that note, placing Nigeria on the red list. These are other countries that have recorded and detected the Omicron variant. So, in the case of Nigeria, what is the red list looking like in terms of the handling now? Are we looking at, because most of these cases, some scientists would say, are those who traveled into the country. Is Nigeria checking is travel restrictions or travel directives, or is advisory to citizens across the Nigerians living abroad?
From what we know of the SARS-CoV-2, it goes around the world somehow, sooner or later. It happened with all the variants, beginning with the ancestral variant, on through the ones that have been classified as beta, eta, delta. Somehow or the other, it goes around the world, and right now Omicron is going around the world rapidly, and will begin to also surface in other countries. And a combined response is what is better than individual hasty responses. I think that the World Health Organization is doing a lot to provide that guidance for it. Nigeria, we are looking very strictly at those who are coming to the country. We require now we require tests done maximum 48 hours before you start your flight to Nigeria, maximum 48 hours. And when you arrive here, you do a day-2 test. We are going to increase and speed up the sequencing that we are doing. We are in fact going to do retrospective sequencing of all the positive viruses, COVID viruses we have had since October. And then look at particularly at certain countries to see if there is any such Omicron virus variant that came in during that period. But we are going to be doing more sequencing. We have both private, public, and federal and state capacity to do sequencing. And I have already given a directive to the NCDC and NIMA, and also liaised with the Research Institute in Ede to speed up the sequencing so that we can have a better picture of the stand of the Omicron variant in our country. But on the whole, we have not recorded any dramatic increase in sheer numbers of SARS-CoV-2, and there are also no cases, no fatality increases, no cases of hospitalization, and no reasons for concern so far. And that's why we take this watchful waiting posture, while we also observe what's going on in other countries very closely.
Because of what we have seen in recent past of fake COVID-19 tests or test results, and this worries one, because we've seen these altercation between Nigeria and other countries about the validity and the veracity of the results that come out of the country. It's a dent on our medical image. What are you doing in this respect? Because if we continue to see fake test results, the danger is that we might see an increased number of infections and the spread.
Yes, you're right. The fake results are very deceptive and they are dangerous because they give you false, and also whatever it is that's connected with corruption at points of entry. But we are very strict and working very hard to make sure that all cases that are fake are detected. Most of them will have a QR code that can be scanned to test the genuinity of it. But we are also encouraging if you like, double tests, PCR tests and RDT tests before boarding. So you can have someone who will do a PCR test 48 hours at a time, and if necessary, another rapid diagnostic test at the point of boarding to assure carriers that the passenger is free, and when they arrive free of infection, and when they arrive at the point of their destination, they can also have another test done. We are doing the same thing too, and I believe that with that measure, we can arrest most of all the cases that come in. With a better management and collaboration internationally, we can reduce the fake certificates that are being issued. We are particularly strict with our vaccine certificates. They are all very carefully managed, and they are all genuine. They have a code, QR code or barcode that will tell exactly the story of the vaccination and the vaccinated. But there's always room for improvement. We shall continue to improve on the documentation and the recording of the vaccinations that we have done, and also the tests that have been done, and come down very hard on any laboratories that are engaged in sharp practices.
It worries one, Minister, that those who have been involved in these sharp practices, it's criminal because that is what it is. They've endangered people's lives, and we personally have not heard or seen anybody that have been prosecuted, anybody that is held liable to that effect, because those who have produced fake test result, has anybody been called to book? Has anybody been punished for that act?
Yes, there are people who have been reported and who are on hold. And let me say, by the way, that the fake results are not all from Nigeria. We have received fake results from other countries. And it's therefore a global problem. And it's not just a Nigerian problem. We in Nigeria, they have recorded some fake results coming in here. And those who are fake, first of all, are assumed to be COVID positive and taken straight away into quarantine. And to go and until they prove that they are, until they have stayed the requisite number of days, take a test that shows that they are negative. And then from there on, of course, they are lined up and handed over to the police. I haven't followed up from that, but from medical point of view, anyone who comes with a fake certificate or with no certificate is going straight to quarantine, to supervised quarantine.
That's on one hand. Another issue is those who flouted the travel directives. The government has mentioned publishing the names of those who flouted those directives. What is the status of those set of people or those classes of people?
Yes, there have been publications of names of those who flouted the regulations. It has happened, and sometimes there was also an occasion where their passports were confiscated and later handed back only when they have met certain conditions. But we are doing everything we can to discourage that, and also going to look at introducing the rapid diagnostic set in a test, in addition to the regular PCR test, to have a double assurance of the status of the traveler. And we're also doing that for the arrivals. We already have a double assurance for those who arrive in the country by doing double tests. And it is in those tests that we discover the positives that I'm talking about. And because of the very large volume of travelers from the UK, we also have the most positive viruses, COVID viruses coming from the UK too.
So I will come to that in a short. I mean, of course, before I talk about the issue of vaccine and get your reaction on the status of those who are vaccinated and what this means for them. It's also when you mention the issue of the UK, South Africa is another country that has experienced a rapid number of these cases, detected cases. So the UK, for example, will, for a must, house those who quarantine, those who enter into the UK for a maximum days of 10 days, and that they will be tested and they will have to pay. Is that the same way Nigeria is handling those who are, because that country is wanted to contain the situation. Is Nigeria also looking in that direction? Because one of the criticism against the action of government in the first place was when it allowed people to come in and advise them to quarantine. People just went into the larger public and they just behaved like normal. But the UK is saying they will house them somewhere. That is a must, and they have to pay for the quarantine and they have to get tested.
Yes, Nigeria was one of the first to actually begin that kind of practice and to put people at the beginning on supervised quarantine and later on quarantine where they have to pay for it. And only those who test negative will be allowed to self-quarantine at home and then pay or those who have no symptoms and then pay for the 7-day test, and then from there they are allowed to go once they have proven that they are no longer COVID positive. But as far as the supervised quarantine is, we were one of the first to start that globally.
But if this Omicron is saying as that to be handled, there's a way the WHO mentioned it about the way and manner it should be handled. It referred to it as a variant of concern. So if it's described as such, shouldn't the government be thinking in that regard before things escalate? Because it's mutating so fast too.
Well, everybody thinks of it exactly that way, a variant of concern. But even this variant of concern has properties that are not yet fully known. Now, the first concern comes from the experts, the virologists, who have said that it has a mutation of 37 positions, 32 positions, and that's unusual, a very unusual type of mutation. And because of that, it is a virus of concern. Okay, now, from a clinical point of view, we expect that it has to be also quite, if you like to say, virulent, if it has that type of mutation. But the reality is not looking so. It is not looking as if it is as virulent as the Delta variant, for example, despite all the points of mutation there. And it's also not causing severe illness. At least we have no report of any severe illness. So the question of what the virologist sees and what the clinician sees are two different things. And the clinician who is treating or at least examining those who are overseeing the treatment of those who are positive and have the Omicron variant, has reported that they don't have any very adverse effect. Even the case manager in South Africa reported the other day that they haven't seen any very serious manifestation of illness that will be comparative to the nature of mutation that was seen on the virus.
All right, Honorable Minister, I have a series of questions on the issue of vaccination and the implication of the variant to those who have been double vaccinated and the booster shot issues. But we need to take a break now. When we come back, you'll be telling us about the veracity of the vaccination in fighting the Omicron variant, Nigeria's stance and the handling of Omicron, plus some of the reactions that we're getting globally. Stay with us, everyone. We'll be right back. Thank you so much, everyone, for staying with us right here on Sunday Politics on Channels Television. Honorable Minister for Health, Dr. Osagie Ehanire, is being our guest tonight on the program. For those who have lost anybody in the course of the last year or so, I mean, a lot of people will even tell you that 2020 was a year full of turbulence of these COVID-19. And those who have lost people or who have fallen sick from COVID-19 will tell you that it's something to dread and something that we want to take away from our list of activities ever in life. So moving forward, some of the issues that have come to the fore now is the issue of the Omicron. and how the variant is behaving in the last few days that it emerged. The United Kingdom, for example, has placed Nigeria on the red list. So we're getting the reaction of the federal government in this respect. Let's restart now, Minister, and let me begin on the issue of vaccination. How well protected are double vaccinated citizens?
Well, double vaccinated citizens are as protected as can be, because the vaccination allows you to build antibodies that will fight the virus if it gets into your system. Now, it is still emerging how well the antibodies will protect you against any variant. But of the variants that were known so far, including the ancestral variant, the protection was good enough, 80 to 90% in some cases. But as new variants appear, the question that is asked is, does the antibody also protect you to the same degree with this variant? The result to that question will emerge with time. But one thing is certain, and that is that it is better to have that antibody in you than to have nothing at all if you get infected, and that it will give you at least a certain degree, a certain percentage of protection. So the vaccination is good. And I urge all Nigerians to take the vaccination, both the first and second dose, and also observe the non-pharmaceutical interventions that we constantly preach: social distancing, wearing your mask, avoiding crowds and large gatherings, especially indoors.
Talk to us about booster shots. Do we now have a more compelling reason to take booster shots?
Yes, there is evidence that has emerged in studying the global scenario very closely. Evidence is emerging that the antibodies you have in you begin to decay. That is to say, they begin to reduce in quantity and also in effectiveness over time. And the calculation now is that by 6 months' time, they might be too scanty to continue to give you the expected protection. And that is the reason why the idea of the booster dose has come up. And some countries have started applying the booster dose 6 months after your full vaccination. Some have reduced it to even 3 months or 4 months. But the idea of the booster dose is to increase the antibodies you have in your system and the capacity to protect you against any SARS-CoV-2 virus that enters your system. In Nigeria, we have developed a policy also for the booster dose, which will officially begin by the 10th of December. Will be issued, first of all, to the vulnerable, to those who are over 65, and then to those who have comorbidities, and those are the ones who are endangered, from what we know so far, the most endangered by the COVID-19.
So, for example, Moderna says that the Omicron vaccine could be ready by early 2022. Give us an insight into what that means, for example.
Well, there are companies who produce vaccines are very agile in responding to any changes or any new challenges, who are already testing their own vaccines, or perhaps they are against the new variants that come up, because the vaccines are made using elements of a particular virus. And if you can inculcate elements of a new virus into your antigen, and then it goes into production of a vaccine. So there are some that have gone very fast in that, in being able to add elements of the new virus or perhaps any other variant that comes in to create antibodies that are believed to be more specific to that particular variant. Moderna has made that announcement. I think others will follow or are following.
Is the 6-month time gap for the booster shot?
Yes, so far we have adopted that. That is global best practice for now. There are some countries that are reducing it to 3 months, who say as on 3 months. Some have put 4 months, but again, we believe that if we do that as from 6 months, we are going to have a very good result. And we also want to start with those who are vulnerable, those whose antibodies may not be so copious as others. Well, we have said again, those who have chronic ailments, those who are hypertensive, diabetic, or have any other condition that might not help them to build antibodies in the at the same rate, will be prioritized to get the booster dose because they might be more vulnerable to any kind of variant that emerges.
So, how well is our COVID vaccination program?
The COVID vaccination program is going well. We are developing new and more ways of expanding it. We have done over 7 million, about 7% so far. But we have a large number of people that we have to vaccinate. And the program, of course, is dependent on our relationship with the state government because the vaccinators at the state level are actually the implementers. The whole plan is made and then the vaccines are distributed to the states. Just a few days ago at the National Council on Health, we had a meeting with the state commissioners of health to discuss ways of escalating and speeding up vaccination delivery at the state level. Some states are doing very well, others are trying to pick up. We are making sure that the vaccines are available everywhere and that storage facilities are also everywhere and the distribution is going on as efficiently as possible. Those who are to be trained have been trained or are continuously being trained. We have extended the vaccination points also to company hospitals, to some private hospitals, and to staff clinics, and in fact to mobile vaccination points, which you are going to be seeing in markets, in supermarkets, in churches, in mosques, to expand the number of people, the coverage that we want to get for the vaccines. We are not worried too much at the moment with supplies. We have enough supplies. We are receiving a good amount of donations, and we also have on order a good complement of vaccines.
So there's no worry that we might need extra budgetary allocations because of these new variants. There's no possibility of that because you said you have enough.
For the moment, no, we have no worry about that.
Okay, let me ask you, how many have been vaccinated in the rural areas? Because if you look at some of the issues that have been raised, especially from South Africa's situation, it looks so much that those who are more vulnerable to this Omicron are those who have immunity lower than the others. They are more vulnerable. That's what scientists are saying. So in the rural areas, how many of these vaccinations have we done in Nigeria?
Well, that is being driven by state governments through local governments. From experience so far, the majority of cases are in urban areas. And that is true not only for us here, but for other countries. Most of the cases are in urban areas where people live more packed together, where they stay indoors more often, and where population density is relatively high. But in rural areas where they have more open space, people are more outdoors, there's more ventilation, the density population is more dispersed. We have not seen too much of COVID infection. Nevertheless, all Nigerians are entitled to and are going to have the vaccination. And the rollout in rural areas is going on through the states. They have all been mobilized. The training has been done, and we are having a good relationship with state government apparatus in spreading the vaccination around all states. Lagos is particularly good because it's compact, small land area, heavy population. You can reach people more easily as against large states with large land area, or probably those that are difficult to reach, like the creeks or the mountains or the hills. Those ones we have various strategies for any of those areas with peculiar terrain, and also for areas with some kind of security challenge. We have a certain strategy for those ones. We want to reach at least 70% of Nigerian population. We're on the way to doing that, using all manner of ideas that will work and help us, and also improving the relationship between federal, who receive and distribute the vaccines, and the states who dispense them, working with the local government. So that relationship is extremely important, because the success we get at the federal level depends on what goes on at the state level and local government level. But we are doing everything to reach all Nigerians, including those in rural areas and hard-to-reach areas.
So out of the population, you said you are working on a certain percentage. How many people have you vaccinated so far?
We are going for about 111 million, nearly 112 million Nigerians we want to vaccinate. Of that, we've done about 7% so far. And we are going to have a more rapid increase in these vaccinations as the strategy begins to manifest. We are developing new strategies for the rollout to expand their coverage. So up till now, it's about 7%, and of which about nearly 4% have received double dose.
So can you give us an idea of how much the federal government has spent so far on this COVID-19 vaccination and treatment?
On procurement, well, we have procured Johnson & Johnson. I mean, federal government has procured Johnson & Johnson, about 40 million doses. And if I remember correctly, it's about $29 million. The 40 million doses of Johnson & Johnson will come in stages. We have not requested that we brought in bulk, because we are going to be receiving them as we are dispensing them. In addition to that, we have received doses, various doses from partners and friends and other countries, bilateral arrangement, all going through the COVAX facility. And the COVAX facility collates all the vaccines that other countries want to give to us, or to other countries, or to spread or split among countries, and they are verified, certified before they are received in our cold chain. And those ones are both AstraZeneca, Pfizer, and Moderna, which we are dispensing. So we're using about 4 different types of vaccines right now.
So can you tell us how much in total that we may have spent so far?
On the amount of vaccines we have procured, that's about 29 million, but we have about 100 million doses totally, if you are going to look for a number of doses that are available. Not that all of that 100 million is here in country. We request them to be delivered in phases when we are ready for them. So those vaccines are delivered on order. Nevertheless, we do receive bilateral offers. Like one country will say, we have this number of vaccines, we would like to give you 500,000. We received about 1 million doses from the UK also. We have received many millions from the United States, and from various countries who offer you 500,000, 250,000 of the vaccines that they have in excess of what they want. So those ones make up part of our inventory of vaccines that we are using at the moment, in addition to the ones we have procured, that the federal government has procured.
It's a sad story, the facilities and the architecture for local vaccination program. Is there any hope that Nigeria might be able to locally fabricate, get something done in terms of vaccination?
In terms of procuring vaccines, you mean?
No, local.
Of producing vaccines.
Local manufacturing,
yes.
not the production of vaccines.
That is our aspiration. The government is working on that. This administration, I'm saying the administration of President Buhari, has put emphasis on trying to be as self-sufficient as possible. And the vaccine production site that used to be in Yaba, which stopped working in 1992, is being revived in partnership with a company pharmaceutical company, in which the government owns 49%. This company is known as BioVaccine Nigeria Limited. It is in fact built to produce routine vaccines, but we are also working with them to include COVID vaccines in their repertoire of vaccines. And for that, we are working with eminent Nigerians who are helping us to get the necessary access to the to technology and to the partnership required to produce these vaccines. We are working very hard on that. The government is ready to also put some money on the table once we have reached an agreement with BioVaccine. And the central bank is also willing to support it. But what you need is the know-how, and the government is an optaker, or the kind of capacity for internal production, beginning at whatever level. There's a downstream level, which is the fill and finish, that you import the vaccines in bulk and then put them into their vials until you start actually producing the vaccines. Those are various phases, or in fact also testing and developing vaccine candidates, which Nigeria is also working at, because there are two Nigerian vaccine candidates out there that are waiting for clinical trials to see if they can go into production.
Can you tell us, Minister, how
chain,
much has been invested in this, and when are we likely to have a locally manufactured vaccine on our soil? Do you have a date in mind?
Are you talking about, if you're talking about the COVID vaccine?
You're talking about the Yaba facility.
That we cannot, no, we're working with a pharmaceutical company, and that pharmaceutical company is the majority shareholder in BioVaccine Nigeria Limited, which is the vaccine production entity that we have in country that the government is supporting. So the question of when they will start producing depends on when they get the technology, they get the partners who give them the know-how, and who give us the know-how, and if we produce the support, the backing, the financial resources which central bank has promised, which we see as a national security issue, to actually be able to manufacture our own vaccines, not necessarily for COVID alone, but from the routine vaccines we are already dispensing, and also for, as a matter of readiness, for any future vaccines that may be required in case of any future outbreak of this nature, so that we have the know-how, the capacity at that time not to be asking for vaccines from outside the country. But the question of exactly when depends on the partners that we have. It might be as soon as possible. There's one producer I have heard of, informally, not a letter, that has offered to come and open up a production plant in our country, which we shall welcome very well. We are not making that official yet because the message is not yet official. It is just by word of mouth that I heard that.
Okay, quickly, Minister, we just have about 2 minutes or thereabout to close the program, and I'd like to get these two or three questions to you as fast as possible. Considering the people who will be traveling home this December, what plan is the federal government coming up with? Because people will mix up with each other, they welcome families into their homes. What do you have any specific plan?
Well, yes, we have reduced, for those who are coming into Nigeria, we have reduced the period during which you must have done your pre-travel COVID test. We have reduced it to 48 hours. It used to be 72 hours. We also value those who have received double vaccines, so already double vaccinated. And those who arrive here will do a day 2 test that will tell us whether they are positive or not, seroconverted. So those are measures that have been on ground, which we are one of the earliest to develop these methods across the world. And all these regimen, the processes we developed long ago, and we have modified all the time depending on the situation. But at the moment, we don't have any plans to have been restricting other countries to arriving into our country, because we do these tests, and we believe that these tests will help us. In addition, we insist on adherence to the non-pharmaceutical interventions. I know it's very difficult right now because of the festive period to tell people that they should social distance, that they should put on masks, but we want to rely on organizations like yours to continuously support the messaging to Nigerians to protect themselves. I have my own mask right here, you will see it, and I just took it off only to answer to respond to this interview. I'll have it on right now. Immediately I'm through with this. And I want it to be the same for others. And it is wrong to take off your mask when you want to speak. That's precisely when your mask should be on. Some people have a habit of removing it when they want to talk. And especially if you are going into a gathering like the church, observe social distancing, wear your mask, do not take it off, and sanitize, and avoid unnecessary travel, especially if you are going public transport.
Minister,
make sure that you
we need to close now, but the final shot will be, is there any possibility of a third wave because of this new variant of the virus?
Well, yes, we had the so-called third wave already with the Delta variant that came in. This is what we are looking at as a fourth wave, and it was predicted here. We predicted this as far back as a month ago, that there might be a fourth wave in Nigeria, and it is perhaps in the world, and it is almost accurately manifesting. We hope that it doesn't get to be that, and if it becomes a fourth wave, it will not be in any way deadly to our citizens. But we did predict that there might be a fourth wave, and which will probably have been triggered now by this Omicron variant.
Honorable Minister for Health, Dr. Osage Ehanire, thank you for creating this time to sensitize Nigerians and educate everyone about this virus and, of course, what the Nigerian federal government is doing in this respect. And, of course, every citizen needs to take every precautionary and every cautionary measures in safeguarding their own lives and that of their families. Thank you so much, Honorable Minister, for joining us tonight. Well, that's our show for today, everyone.
Well, thank you for the opportunity.
I'm Sean Kimale. Bye-bye.